Hello everyone. My name is Alex Craen. I'm a second-year emergency medicine resident from Florida, and I'm excited to talk to you all today about a project I've been working on for the past year and a half, creating a curriculum for paramedic students using a new flipped classroom approach. There's a lot of other residents involved in the project, as well as our mentor, Dr. Walker. She completed an EMS fellowship, and she's a local medical director and had ties to a paramedic school that let us take over their classroom training, essentially, called the Orlando Medical Institute. Just briefly, I want to talk about EMS in general, the importance of teamwork with our pre-hospital providers, then a little bit about the specific modules that we created, and then the initial results of the study that we've done, and most importantly, how you can get involved, whether it's through this module or otherwise. So EMS dates back in the United States to the Civil War, ambulances running around picking up patients, and went largely unregulated until the 1960s. In fact, nearly half of the ambulances were owned by funeral homes. It doesn't really provide a lot of confidence in your outcomes if they come pick you up. But in the 1960s, a paper was released showing how bad the outcomes were, worse than in combat zones, and a lot of it has become more regulated since then. Including the education of the paramedic students, and the knowledge base has increased a lot too, so it's really important that they're well trained. And it's important because your patient's care starts at the scene. It starts when they find the patient laying on the ground surrounded by pills. It starts in the car, so crushed they need the jaws of life to get them out. It starts with the questions they ask the family, the witnesses, stuff that you can't get in the ER. So it's important that you take them seriously, their care seriously. They can give meds, they run codes, and the earlier, especially for cardiac arrest, defibrillation, CPR, starts, the better the outcome. So this is your patient's outcomes start there. And that's why teamwork's important. So we need to keep lines of communication open. We need to make it easy for them to ask questions of you, easy to come back and see what happened to the patients that they dropped off. And vice versa, you letting them know what you'd like to know next time, or ask them why they did what they did en route. So a good way to open those lines of communication is to start from the very beginning. So we as residents teaching paramedic students, kind of starting at the beginning in both sides, and we specifically chose a flipped classroom concept. So if you're not familiar with that, that's where you do a lot of the initial didactics and learning at home. Usually online, and then when you come into class, you can spend a lot more time in discussion and really getting a deeper understanding of the content rather than just like listening to a lecture. So we broke down the entire curriculum into modules. Each includes a case just to give you an idea of what you should be learning, a podcast, videos that we recorded so that the students can watch it at home, a framework to go over important protocols like how to deal with abdominal pain or altered mental status, and then some discussion questions that they can delve into a little bit deeper when they come into class. I'm not sure if you can read this, but this is a sample schedule that kind of shows how we use the flipped classroom approach. So they have stuff that they're doing at home, so they're reading the chapter from the textbook, they're watching the videos that we made, there's sometimes pre-class quizzes, and then they prepare for the activities they'll actually do in class, which is much more interactive. They do Jeopardy, there's a vocabulary activity for this one, and they have an opportunity to ask a lot of questions rather than just listening to an instructor talk for hours. So this is an example case that comes with every different topic, different module, just so they know the types of information they should be getting from these kinds of patients, the kind of physical exam they should be doing, the differential they should consider. So you have a female who's pregnant with shortness of breath, so it talks about DVTs, cardiomyopathy, et cetera, and then sort of the initial management that they can also do, like giving oxygen or potentially CPAP. So just to give a real-world application for the lectures that we're giving. And I think the residents really got most involved in the podcast we created. So we recorded 20 to 30-minute lectures on each of the modules. This shows a picture of Dr. Benzing talking about pharmacology. There's also ones on trauma, GI, cardio, et cetera. And some of them include discussions like the picture on the top right. That's Dr. Walker, Dr. Roca, and then one of the paramedic instructors all kind of talking about the topic to make it more interactive even in the podcast. We also created frameworks for the kind of most common complaints that they're printing out on big posters and putting up around the classroom. It includes some pearls, like could abdominal pain be cardiac? It talks about when to decide to give analgesics if they're in pain, and then some important parts of the history of the physical exam they should consider that would make them think the patient might be having a life-threatening condition and should probably go lights and sirens to the ER. And then we included discussion questions, which, as I mentioned, they talk a lot more about in the classroom when they get back. And they delve a lot more deeper, something you couldn't necessarily just get from a lecture, like how does respiratory arrest lead to cardiac arrest, acid-base disorders, intubating without RSI, things that do a lot better in a discussion format instead of someone just talking. So the cool thing about making this EMS curriculum is that it became an EMS curriculum for us as well. So as residents, we learned a lot more about the scope of practice of paramedics, their capabilities, the medicines they have on board, and then they in turn learn from us what we want to know from them as paramedics, what we want them to get from the scene, from the patient before they get here. And I think in general it just became education for everyone. It really solidified our understanding of all the topics. In any way that you can, whether it's this module or otherwise. Thank you.
So again, I think this presentation really highlights how the emergency department and pre-hospital care can work together, and I think it's great to see changes come to the pre-hospital education curriculum as well, because I think it's long overdue and I think will improve the process overall. So thank you.